So my name's Vinny. I work for an organisation called ResultsUK, working on international development and global health advocacy in London. I work specifically on the tuberculosis brief, so I work closely with UK parliamentarians and other TB stakeholders in the UK to try and drive meaningful change and hopefully end the TB epidemic by 2023. The reason we brought our delegation out to Kenya was because we know that Kenya has made real positive strides in global health, and we wanted our parliamentarians to see that firsthand, because we very much believe at Results that it's much more powerful to see these things firsthand instead of hear them or see them on the media. It's much easier, and you can tell a much more convincing story in Parliament and to your constituents when you've actually been and seen the clinics, seen the people living in poverty, seen the children who are growing up in those areas. And we find that really makes a difference in the way that parliamentarians approach global health and talk about funding it in the future.
Why is it important for the UK to eradicate tuberculosis by 2023?
I mean, I don't think it's necessarily just for the UK why it's important. I think it's an issue of global importance. Tuberculosis is humanity's oldest disease. It's been around almost as long as humans have been. And yet in that entire time we haven't come up with a good vaccine, a good treatment which has effectively eradicated the disease, in the same way that we have seen with things like smallpox and polio to some extent. Tuberculosis is a disease of poverty. No one is safe from it. And in a similar way to the COVID pandemic, because of the way it transmits, it's able to get anywhere in the world. So just because we in the UK don't live in a particularly high prevalent country, it doesn't mean that TB can't effectively come for us, especially with new strains of multi-drug resistant TB, which are strains of TB which are immune to modern medicines. So it's important to solve TB by 2030 because at the moment 1.6 million people die a year of TB, and they don't have to die. Those are effectively needless deaths. But the reason those people die is because the international community isn't doing enough to raise money, to raise awareness, and to get the medicines that we do have out to the areas in which they're needed. And so it's really important for us, for parliamentarians and others, to see the impact of the tuberculosis pandemic firsthand, and then be able to take that information back to the UK and effectively say, no one's safe until we're all safe. ResultsUK is part of a global network of organisations called the Action Partnership, and CANCO is also a member of that organisation. So we work quite closely with them on a lot of issues, not just on the delegation that we've organised this week. So we often align on things like strategy, messaging, some of the same issues that we want to push in this kind of global umbrella in which we work. We all work together so that in each different country we're kind of pushing the same message and pushing the same statistics, with the idea being that if we can drive change in the UK, in America, in Canada, in Kenya, all at the same time, we'll get a wider base of support to drive meaningful change in global health. And so we've worked really closely with our in-country partners in Kenya this week, CANCO, because ultimately CANCO here, they have the relationships, they know the right people to go to, they know the best facilities to visit, they've seen the excellent work being done in global health firsthand for themselves. And so we would be missing a trick if we didn't use some of their information and use some of their contacts and use the expertise and knowledge that they've built up over 30 years as a global health organisation to try and make this delegation as effective as possible. One of the big highlights for me was the TB clinic. It was not what I expected, but it was really encouraging to see a group of staff who were clearly incredibly passionate about the work that they did. Kind of come hell or high water, they would be there with doing the TB treatments, looking after MDR TB patients who had to come to the clinic every day. I think seeing that was a real highlight for me, because I've worked on the TB portfolio for about 2 years now, but that's the first time that I've ever got to see a TB facility in person, and it's really kind of shaped my understanding of how these things work on the ground. It's one thing to read it in a book, or to read it in a parliamentary briefing about how these things work, but to actually go and see it yourself firsthand, it's really helped to it's really helped me understand the work that I'm doing a bit more and why I'm doing it, and who are the people that are benefiting from the things that I do distantly in the UK, but then which are also being done on the ground in Kenya.
The UK have been able to effectively manage tuberculosis. What can Kenya learn from the UK?
I think it's an issue of priority. I think we need to do more to find the missing cases, which is quite a big issue in the Kenyan context. So that requires really robust contact tracing. It requires really good engagement with community health promoters and also other community leaders. I think really what Kenya needs, and actually it's not necessarily a problem that Kenya can solve on its own. We just need better medicines for TB. We need a vaccine for TB, and we need to be able to distribute them really easily and efficiently to the parts of the world where they're needed. So we have the medicines which can kind of help tackle TB, but Kenya just doesn't have as much access to them as the UK does. So what we need to do as international partners is we need to speak to the drug companies, we need to speak to other TB stakeholders to find ways to increase the supply of drugs and increase the supply of TB expertise and other things into Kenya so that they can sufficiently tackle their TB burden.
Maybe finally, there's a lot of TB-related stigma in Kenya. Is the situation similar in UK? And if not, what has been done or what can be done to try and eradicate the stigma related to tuberculosis?
I mean, in the UK, we don't have a lot of kind of direct stigma. I think the issue that the UK has is that whilst we do have a few TB cases, they're really small compared to the wider population. And actually, if you speak to people in the UK and I say, and I do this frequently, I say I work on tuberculosis, they go, "Oh, I didn't realise that was still around. I didn't realise that was kind of still a disease. I thought that was something that happened in the Victorian times." But I think the way that you challenge stigma at all levels is by awareness. I think a lot of stigma derives from just a lack of knowledge about topics. I don't often think it's founded in ignorance. I think it's just found in a lack of knowledge about a topic. So I think, and we've seen this from the work of the delegation so far. When people are educated about what TB is, how it's transmitted, and how it can be treated, I think the levels of stigma go right down. So we just need to do a better job of talking about TB, raising TB awareness, and letting people know that having TB is not the end of the world. There are ways to solve it, and people who get TB don't deserve to be stigmatised. They deserve to be looked after and helped and treated medically. And I think that's the way that we tackle the stigma.